Well, India has set another new record for coronavirus cases, 200,000 in the last 24 hours. And just in the first half of this month, 2 million new infections have been logged. Experts are blaming complacency and frustration among the public for the surge. Many states have started reimposing restrictions such as curfews. As the cases increase, so does the demand for vaccinations. DW's Manira Chaudhary reports from Ghaziabad.
At the small private hospital, people are struggling to register for vaccination against COVID-19. Satish Sharma is one of them. Almost 70, he has come for his first shot.
When doctors and frontline workers told us they are safe after vaccination and will not get very sick even if they become infected, I decided to get it as well. That way I either won't get infected or at least I won't be that sick if I do.
But the crowd here today is larger than usual. One staff member called it chaos. This hospital in Ghaziabad at one point had to turn people away because they had run out of vaccine.
The past few days saw reports of many hospitals in this area, including the one right behind me, face a COVID-19 vaccine shortage. While some hospitals had to cut down on the number of people they were vaccinating every day, others had to stop the vaccination process entirely for a few days. These reports came at a time when several states in the country are facing a COVID-19 vaccine shortage crisis, including Maharashtra, which at the moment is the worst hit state.
The hospital did receive its stock of vaccine today after having gone for nearly a week without. People are hopeful they can get the jab. While there was some hesitancy to get vaccinated earlier, the past few weeks have seen demand increase rapidly.
We didn't have the vaccine available for a short while. I don't know why we weren't getting supplies. Since the second wave started, more people have started coming for vaccination. Before this, there wasn't such a rush.
India is recording an alarming number of new coronavirus cases every day, and infections are now spreading much faster. As hospitals scramble to increase capacity, there are clear signs the Indian healthcare sector is again coming under severe strain. Dr. Shuchin Bajaj, who founded a chain of hospitals offering affordable care, calls the second wave a tsunami.
The numbers are mind-boggling. The medical infrastructure is completely overwhelmed. We are struggling to get medicines, struggling to find oxygen. Patients are struggling to find beds. And it's a 24/7 job for us to arrange beds and arrange the equipment needed and arrange the doctors needed to provide the facilities that are necessary to combat this pandemic.
Bajaj says he is disappointed that the lessons from the past year have not been learned adequately. For the people waiting here, there is some relief, at least for now. They are getting their shot, hoping that will give them some protection against the coronavirus.
And Manira Chaudhary is joining us now with The View from Delhi. Manira, we heard it there from that doctor. He said the numbers are mind-boggling, the third wave, a tsunami. We know India is producing vaccines on its own. How quickly can these efforts be ramped up?
Well, it has become a matter of concern. And while there is no final word on how quick we can ramp up the manufacture, but Adar Poonawalla, the head of the Serum Institute of India, which is the largest vaccine manufacturer, clearly stated last week that we are falling short. We are not able to produce vaccines to match the increase in domestic demand, which is consistently rising because of the second wave. People can see how fast the second wave is spreading. Poonawalla also said that the industry needs a large monetary support from the government to ramp up the manufacture of the vaccine. The government also needs to relook at its regulations and approval processes. That needs to happen. The government has been caught in a tricky situation because the domestic demand has shot up quite a lot. And now there are questions also being raised against the large export of vaccines that the government made, considering that India itself has a huge population of people. And because of the rise in infections, the vaccine hesitancy, however, of that was there, has now turned into an increasing demand of vaccination. So there is a tricky situation.
And there's an immense pressure on an already strained healthcare system. What are authorities doing to stem that pressure?
While the Indian healthcare system again looks at the brink of collapse, there are reports every day of different states where the healthcare infrastructure is getting immensely overwhelmed. The government, especially the state governments on their part, what they're doing is they're trying to ramp up testing, they're imposing restrictions, they're trying to turn areas like banquet halls and sports complexes and schools into makeshift isolation wards and healthcare centers for those COVID patients who are not very serious right now. So these are the efforts that the government, the state governments are making to reduce the stress on the hospital staff.
Do people trust those efforts, Manira? Do they still trust the government to get the situation under control?
Well, what I can tell you is that there is a growing criticism because it is evident that the government, the national government, is allowing, let's say, the Kumbh Mela, the Kumbh Fair, which is the largest Hindu religious festival, to go on in North India, where there are hundreds and thousands of people and no COVID protocol is being followed. There are also reports of people testing positive at this fair. At the same time, we have some states who are going through elections, and the national government, the national party, the BJP itself is seen holding huge election rallies where no protocols are being followed. And when it comes to the vaccine shortage complaint that some states are raising, the government has gone into a very dismissive mode in which it's trying to put the onus entirely on the state governments of what it calls an efficient distribution that should be made. So yes, I'd say that at the moment, there is a growing criticism against the government.
DW correspondent Manira Chaudhary in Delhi, thank you.